There's going to be some audio in this talk. I need to do a sound check.
Great success.
It works. All right. Just by round of applause, if this topic is something that you might experience in your job. The rest of you who are not clapping are lying. What do we mean by difficult consultant? It can mean anywhere from demeaning, interrupting, de-energizing, disrespecting, rude, obstructive. Whole thesaurus full of words where you might think, God, what a jerk. And we know that patient care can suffer, and we know it just saps our joy. So what do you do about it? What do you do about it? Well, take some forethought and some foresight to plan for this. And believe it or not, you do have agency in these situations. And there's myriad ways to go about it. I'm going to give you a few tactics on ways that you can prepare, and then a few things you can do in response to the difficulty should it turn up. So let's talk about you. Let's talk about us. When you give a presentation, get set. If you regularly experience intimidation or conflict, take a pause before the call to create the mindset that you want. For example, I have a client who gets really intimidated by making calls to tertiary care centers as to transfer a patient. And especially when speaking to the sub-specialists, feels just intimidated. And so what he figured out was before making the call, actually before answering that phone, he would think to himself, remember, this person takes smelly poops too. And just that frame shift allowed an internal de-escalation, and it leveled the playing field. When you give a presentation, give the bottom line up front, lead with the need, and know your ask. Because when you don't do these things, you're setting the interaction up to fail. Let me show you what I mean. So, Karen, this might not be something so foreign, working in the ED all those shifts. Sometimes when we're tired, we can be wandering historians. Fair enough? I mean, we hate it when patients do it, but we do it. And if your presentation begins with, yeah, I got this guy. If that's how it starts, you are making your consultant work to decipher what the heck you're talking about and what your ask is, versus clear, concise presentation, sword mastery. Hey, this is Dr. Karen in the emergency department. I have a patient who appears to have a complete small bowel obstruction based on presentation and CT, who I think needs to go to the OR. Here's the story. Don't apologize for calling them. Don't apologize for bothering them. I guarantee we have all said this. Hey, sorry for bothering you. Don't do it. And if you think this doesn't happen, I studied this. Yes, I'm a scientist. I studied this on Twitter. And this proves beyond a doubt that this is a real thing. And when you apologize just for calling someone, you are setting up a power dynamic where you are the subordinate, and you're not. If you want to acknowledge the late hour, great, do it. If you want to show some gratitude that they called back so fast, super. But don't apologize. And every consultant I pulled on this, universal. Don't apologize, but they also love it when we're nice. Now, sometimes things heat up and there is conflict. And when there's conflict, what do you want to? You want to just give it right back to them. Just, yes. No. That's not it. So when you are in the midst of this conflict, decline the invitation. Because when the conflict arises, when the heat comes up, you are being given an invitation to join a bit of drama. So just acknowledge that when you feel the frustration or the anger coming up, and decline the invitation to the dance. Don't take the bait, validate. If you are getting a litany of complaints on the other side, you people on the other thing, validate. Hey, I hear you. It can be so frustrating taking care of these issues. Empathy is the antidote for tension. Balance, tone, and valence. If they are in full limbic fight mode, then you need to help walk them down in de-escalation. For example, if a toddler is having a tantrum, you walk them down and walk them down. If your consultant is acting like a toddler, you walk them down. Identify the barriers. What's getting in the way of X? What needs to happen for X? Transparency is the antidote for miscommunication. And the sword of insertion, which is a polite way to interrupt an escalating cycle in the conversation. So this is an interruption technique. You're getting the litany of stuff, and it is like this. Hang on, just a sec. Let me be sure I heard what you said. And then you mirror what you think they said. You might not be right, but it's a polite way to get your foot in the door and start things over. Now, in case of emergency, break glass. If things are dangerous or not going well, you can call them back on a recorded line. Hey, it seems like we're at an impasse, and I think our next best course of action is to talk on a recorded line and have the transfer center call them. Now, you're not doing this as a smackdown or to punish them. You are giving them a chance to think some more and maybe reconsider or just consider. And when you call them back, don't paint them into a corner where they're going to be defensive or they're going to lose face. Allow them to show up. And if things are still going south, well, reiterate what they are saying. Mirror them. So this is super clear. You are asking me to discharge this patient, transfer this patient, etc. It's an amazing corrective action. It might not get you on a Christmas card list. But if things are escalating on this line, it is the time to double down being professional. So what might this look like or sound like in real time?
Hey, this is Rob Orman. Oh, hi. Appreciate the quick call back. I've got a patient with ischemic bowel who's going to need to go to the OR. Here's a story. Yes? No? No, I don't have the lactate back. Yes, I did go to medical school. Well, could you just come in and see them? Can I admit them to the hospitalist? What?
All right. By round of applause. Has that conversation happened to you? Yeah, right. All right. That happened fast and furious. So what can we do? Don't take the bait. Validate. Oh, I hear you. It is so frustrating not having the lactate back. That's just how it's playing out in this situation. This sort of insertion. Hang on just a sec. Let me be sure I hear what you say. That this patient won't be seen in the ED until the lactate's back? Do I have that right? And then identify the barriers. What's getting in the way of you seeing this patient in the ED? Oh, the lactate. Well, I know. It's just how it's playing out in this case, and it's so frustrating. When we're done, I'm going to call the lab, and by the time you get here, I'll have an update. What's this all about? Well, it's an onion, obviously. On the outside, it's about getting patients the best care that they need. But deeper on the inside, it's about you, it's about us experiencing joy at work, because these conversations can be so draining and miserable. So this is about finding new ways and being objective and being discerning and being professional and finding an entirely new solution to what can be a difficult situation. I hope this was useful.